Conference will now be recorded.
Hello, everyone. This is Dr. Edwin Lee, and thank you for attending another CPS webinar. Today is a friend of mine, Dr. Robert Kominiarek. He's going to be speaking on overcoming leptin resistance with melanotan 2. And before we begin, if you can mute yourself, that'd be great, because there's always background noise, and it's hard for me to talk and always mute people. But if you could do that, that'd be great. Before we begin, let me just do a disclaimer. This webinar is provided as a general guideline and for informational purpose only. The information is not intended to replace medical advice by other physicians. Readers and viewers are encouraged to confirm the information provided with other sources. Dr. Edwin Lee, Dr. Luis Martinez, Clinical Peptide Society, and the guest lecture will not be liable for any direct or indirect damages from information provided. We do not endorse to use peptides sold on the internet for research purpose only. So let me see if I can mute that. All right, and mute Morgan. All right, so let's keep on going. Some housekeeping notes. If you have any questions, please type in your question in the area of the webcast interface and silence your phone. This meeting is recorded. So we are finally up to 9,538 signatures in Save Peptides. So for those who've never seen this before, if you go to either clinicalpeptidesociety.com or savepeptides.org, you'll see this this petition, and you just sign in your contact information, and if you want to leave a comment, that's great. So here's some recent comments, and that is 2 days ago from Joanne in Colorado. I personally have used peptides. In 2012, she developed C. diff after a few doses of clindamycin following a long-standing microscopic colitis. After a year of visiting multiple providers, functional medicine and traditional medicine, I'm finally noticing improvement after using the peptides and tweaking supplements with meal planning. Please do not mess up this amazing modality to improve health. So Jennifer from California, 5 days ago, I suffered from chronic illnesses that have been significantly helped by peptides. I don't want to see Big Pharma do what they always do, make it illegal, and then hide it forever from everyone, because they want to keep us sick forever. So 2 more comments. One from Abby in Oklahoma 1 week ago. I believe that the U.S. citizen should have access to peptide therapy in a legal and safe environment. And I truly believe for that. I really want to work with the FDA so that the 503A compound pharmacies can be inspected and keep it legit in terms of injectable peptides. And here's Lyle from Florida 9 days ago. Peptides prevented me from.
And then I lost my wallet there, my phone there.
Let me
And I
silence.
came all the way back from home, so we just had to go up there.
Let me silence these 2 people. So, all right. So Lyle from Florida basically said peptides prevented me from needing shoulder reconstruction surgery. These are game changers in health. And anyway, before I introduce Dr. Kominiarek, let me just mention that there are some people who missed our longevity summit. We sold out on January 24th. We had 70 people signed up, and that's the maximum room size. So we're going to have it a little smaller place, also in Orlando. It will be at Harbor Chase on June 27th. So for those that are interested in learning beyond peptides, we're going to talk a lot more than what's listed on the right, but we'll go over really evidence-based therapies to help with longevity. We'll talk about the 4 evidence-based diets for longevity, exercises to increase VO2 max for longevity. We'll go into senolytics, xenomorphs, umbilical cord tissue products, young plasma therapy, therapeutic plasma exchange, peptides and other emerging interventions, the power of clotho, epigenetic reprogramming with the Yamanaka factors. There's an interactive exercise program, and also a certification test. And we'll also talk about a very simple test to look at the most toxic heavy metal that you can do on Monday. And therapeutic plasma exchange will not remove it. So we'll talk about that. So let me introduce you to a colleague and a friend of mine, Dr. Rob Kominiarek. He's a board certified fellow of the American College of Osteopathic Family Physicians with advanced certification in age management medicine and bioidentical hormone replacement therapy. He's a medical director of Renew Health in Ohio, and he's a veteran of the U.S. Army and a best-selling author of the Low T book. He also presented in March of 2022 for Clinical Peptide Society on peptides for COVID. And that was the best talk. I mean, we had almost close to like 100 people listening to that, and we've never like matched that number. So I am going to make Rob the speaker. So just make him the presenter. And so Rob, if you can share your slides. Let me unmute you. 1 second. All right, Rob, you got to unmute yourself and then share your slides.
Okay, now you can hear me, right?
Yes, I can hear you.
Slides, can you see them?
No, well, let's see.
Let me do one more thing here.
If you hit share.
Yeah, yep. Share, boom, and select tab.
Select your, I think, window.
Boom, got it.
Perfect. You can see it. Hallelujah.
Yeah.
I have only had 2 healthcare providers that couldn't do this. So, anyway.
I'm a little bit more used to Zoom, but hey, we got it.
You got it. Cool.
Yeah.
Perfect.
Let's see.
So you have the floor.
All right, good deal. Well, thanks for having me, and hopefully I can be of service to everyone and open your eyes as to how powerful melanotan 2 can be with regard to helping individuals with weight loss. And what we'll do is we'll focus particularly on those with leptin insensitivity and the benefit of melanotan 2 helping control their hunger cravings, and what other options are available if you do have trouble with melanotan 2 in getting control of their excessive snacking. Just a brief review on melanotan 2, and you can see this slide okay, correct?
Yes.
Okay, all right, just some basics. Melanotan 2 is a synthetic cyclic lactam, which is an analog of naturally occurring melanocyte stimulating hormone, and it is a trimmed version of melanotan 1 with a longer half-life. I know Brooksville is no longer making melanotan 2. They're only making melanotan 1. I'm not sure what occurred that they can no longer make melanotan 2, but that's where they're at. It was originally used as a tanning peptide, and it's been shown to control skin coloration and pigmentation. One of the downsides of melanotan 2 is that it can make lesions darker, it can make freckles darker. So you do have to pay attention to that. Same mechanism as melanotan 1 and does not cross the blood-brain barrier. It's melanin produced by the melanocytes through melanogenesis, determines skin, hair, eye color, protects cell from sun rays, DNA damage, and very protective as well. It interacts intrinsically with multiple systems, inflammatory, immune, endocrine, central nervous systems through various receptors. There's 5 melanocortin receptors, and we'll be talking specifically about 3 and 4 and how melanotan 2 interacts with them. So it's a multifunctional peptide that regulates a diversity of physiologic functions. Again, there are 5 melanocortin receptors, 1 through 5, and we're going to talk mostly about 3 and 4 and their role in being able to control body weight and feeding, excessive feeding, snacking for individuals who are leptin insensitive. A lot of benefits to melanotan 2 in the sense of tanning. It's also referred to as the Barbie peptide. It does lessen appetite. It does improve lipid profile. You'll see a decrease in LDL, a raise in HDL. It does help with glucose regulation. And depending on the dosage, can have a significant effect on libido. So it can be beneficial from a sexual standpoint as well. From metabolic function, it's lipolytic, so people will lean out on it, especially if they're leptin insensitive. You'll find it's very easy to get fat reduction with these individuals, and it helps control appetite and anti-inflammatory, antioxidant components as well. So let's talk a little bit about how I'll use or determine whether I'm going to use melanotan 2 in individuals. One of the genetic tests that I like to use is Intellex DNA. And any of you that might be using, I think you'll find it beneficial. And in the obesity section, you'll be able to see if they have SNPs with regard to leptin insensitivity. And what you'll often find with these individuals, and especially with the numerous diet fads that are running out there, oftentimes you'll see these people with leptin insensitivity skew towards keto because they're having trouble with their nutrition plans and they seem to be gaining weight even when they just look at things. They don't even have to eat them and they feel like they get fat. And they'll skew over to ketogenic type nutrition plans or even carnivore, and they'll take in way too much saturated fat, which generally makes things even worse. So they'll be really shocked that when they go on a carnivore diet or a ketogenic nutrition plan, that they actually get fatter. Like they lose muscle and just get more fat weight. And part of it has to do with that leptin insensitivity, and higher saturated fat diet just really increases their obesity profile. And it's actually getting them off the higher saturated fat diet and actually bringing carbs up, which would be counterintuitive, but we'll take their carbs up really high to control hunger and actually get them to transpose fat from muscle and lean out. And they're shocked when we take their carbohydrates up 300-400 grams a day. So the benefit of using the melanotan 2 to help control the hunger cravings is that it engages that melanocortin 3 and 4, and specifically a little bit more 4, so the receptors become more sensitive to leptin. And then we get the beneficial effects of the increased lipolysis. We get pretty great appetite control. And the other comment that I'll get from our clients that we use melanotan 2 with is they'll state, usually after a couple of weeks of therapy, that nothing hurts anymore. Their low back doesn't ache, their knees don't hurt, none of their joints hurt because of the positive anti-inflammatory benefits. We've had some patients even comment that their eczema will clear up as well from the improved immune function and decreased autoimmunity. So what do you do with the individual that you do give melanotan to and they don't tolerate it well? The number one complaint that I've seen is migraines, where they'll start the melanotan but then have headaches or migraine headaches that are exacerbated by it, And so it becomes very difficult to use um, this particular peptide to help with the weight loss issue. So the alternative, what I do with them, again, it's very counterintuitive, but we really have to get a hold of their nutrition profile to overcome the leptin insensitivity. And we'll calculate out what their protein, carbs, and fats need to look like. And we'll slowly start with a baseline. Usually, let's say the average male, let's say like 180 pounds, that's having issues, and it should be maybe more like 160 or so. We'll start them out around 39% protein, 34% carbs, either jasmine rice or sweet potato, and then we'll lower their fat down to about 26%. We'll keep them there for a couple weeks, and we'll feed them very structured so that we can get rid of the hunger issues, the excessive snacking, because a lot of these people they end up being metabolically deranged because of the excessive snacking in between meals, and then they don't really eat structured meals any longer. So there tends to be a lot of excessive um, um, processed carbohydrate and junk food because of it. So one of the ways we work with that is having a very structured meal plan where we're feeding them 4 times a day, and to cure the metabolic derangement. Because the other issue we'll see with these individuals is that they often become metabolically deranged because they've ended up, they don't want to be overweight, so they chronically restrict calories and then eat the wrong composition of calories to have a positive effect on their body composition. So calories in, calories out can control overall weight, but the composition of the proteins, carbs, and fats will dictate body composition. And then looking at supplements, vitamins, minerals to assist in how they feel. But getting control of their nutrition plan when this doesn't work or in combination can really be beneficial. And then what we'll do is step their carb intake up every week by 25 grams over the course of about 12 weeks. Feed them up, get them to a point where we've got them completely glycogen loaded and on a specific strength training program, which is just 4 days a week. And we actually used minimal sets, 2 sets of 8 to 10 reps. And then once we get them metabolically healed, then we'll start reducing the carbohydrates down, and it'll just strip the fat off of them. And the ticket is getting them metabolically healed first. And then once you can do that, you'd be amazed at the things that you can get the body to do just with nutrition. So that's the other approach that I'll take when they have issues with the melanotan, whether it's usually the most common problem I've seen is chronic headache. I've had one patient complain of heart palpitations that were intolerable, migraine, exacerbation of migraines, and then one that wanted to stop because the pigmentation, the freckles on the face were getting to be too dark. So, but that's how you can use melanotan with these individuals that have the leptin receptor gene, SNP, and can be really beneficial. You can also use intranasal oxytocin. I don't have a lot of experience using that as much as the melanotan, but I definitely like melanotan to help improve, raise HDL, lower LDL, the anti-inflammatory effects, appetite suppression, and the lipolytic effect that you can get from it as well.
Hey, Rob, what is your dose for melanotan 2 peptides? And
It depends on the pharmacy it's coming from. I can't remember off the top of my head. I want to say it's, I want to say if it's not Brooksville. I'm thinking the other, it's Southlake. I think they had a starting at 10, but 10 units, but I don't use 10 units. I come in lower at half. So I'll use 2.5 units to start. to get the appetite suppression. So you don't have to go, the full 10 units because I'm not trying to tan them. I'm trying to get benefit of the appetite suppression. So I'll start at 2.5 and then maybe work my way up to 5. And then I have to do it individual. Some people will get the appetite suppression where it lasts more than 24 hours. They might get 36 hours of appetite suppression. So we can use it like every other day. But sometimes I have to use it like microdose it on a daily basis.
So, do you ever like cycle it like you do?
Yes, I've used it as a tool to get control while I can gain trust with the patient that we can resolve their issue. Because when I move them away from melanotan and into nutrient manipulation, I have to get them to trust me when I tell them I'm going to take your carbs up higher than you have eaten them before, and you're going to lose weight, because they don't believe it, because they look at things like cakes and cookies and candies and donuts, and they think, oh my God, I can't even look at those things. I'm just tape it to my thigh. But I don't, we stay away from those items. I'm very specific with using sweet potatoes and jasmine rice, a little bit of white potato, not as much. My go-to really is jasmine rice because it's just easier to prepare a lot. So from a practicality standpoint, it's easy to make a bunch of white rice, jasmine rice, and have it available for a couple of days. So you're not cooking every day.
Is there a test that you actually look at so that you know when to start reducing the carbs? Like, do you look at some biomarker?
No, I do it by body composition. So I do it by photos. So we'll take a frontal pic, a side pic, and a back pic. And then, I'll calculate out what I want their nutrient profile to look like to start. I usually run it for a couple of weeks. They'll get fluffy initially, and then it's just they have to trust the process. And once they see what starts happening after about week 3, then they're usually on board. And then when I step their carbs up by 25 grams, and they're like, oh my gosh, I'm getting to eat like carbs. I thought I could never eat these things. And then they see themselves getting leaner. They're very shocked, because most of these people almost everybody does the same thing. So it's very counterintuitive. I have them work out substantially less. I stop all cardio, and we just strength train 4 days a week for the next 12 weeks. And the strength training I do is really, they're like, oh my gosh, I can do this. We drop it down to 2 sets, 8 to 10 reps. That's it, at max intensity. And they're shocked at how little they have to work out and how much muscle they start building. So most people do the opposite. They're like, oh my gosh, I've got to lose weight. So I eat less, I move more, which then just creates a metabolic shitstorm and a cascade of inflammation. And then it just starts them down a really bad path. And so it's very counterintuitive to think, wait a minute, I'm going to work out less, and you're going to make me eat more, and I'm going to lose fat and gain muscle.
Well, you're going to have $1 million.
Yeah, but this isn't anything new. This is what bodybuilders have been doing for decades. Most people don't really understand how this works. And we're in a culture now, probably for the last couple of decades, especially with women in particular, where it's move more, eat less. And they start spinning their hormones down, in particular thyroid. Right? The thyroid can't function. You're not feeding it. And so they end up with just a metabolic storm. Nothing's working appropriately. And oftentimes you can heal with food. You just have to know what to do with it, and how to create the composition of the proteins, carbs, and fats. And then they have to trust the process. So it's about priming the metabolism to fire again, because most people that are struggling with weight issues, they've been chronically dieting in very often, many times, for decades. And
Right.
so their metabolism is just crashed. And so you have to repair the metabolism first so you could get it to burn fat. You got to get all the inflammation away. And they've tried all kinds of crazy fad diets. You name it, they've done it.
Do you think that you could do it without the melanotan too?
Yes.
Okay. But
Yeah.
they need extra help.
Yes. So it's labor intensive. If you in your practice have a nutritionist that can work with people, that's great because it very much is labor intensive to work with an individual because you've got to meet weekly with them and make the adjustments that need to be made, and they have to be compliant. The trick to this when you're taking the nutritional route is they have to be persistent and consistent. We can't have cheating. You can't be dancing off and changing things. If we put you on 6 ounces of ground turkey and 6 ounces of jasmine rice with 1 cup of green beans, and we nail down your food groups or what you're eating, they have to be consistent with it because it's the consistency and persistence over time that will pay off. And so they have to trust the process. I like using the peptides because it gets them moving, right? They get to see some initial benefit and then they get to trust. Oh, wait a minute, this guy knows what he's talking about. Okay, I can trust him. So when he tells me he wants me to do this, I'm going to do it now. So same thing with GLP-1s and anything else that we do with any other medications. You can use them as a stepping stone to building trust um, and getting them on the right track with their exercise and their nutrition. Because if we really get down to what are the levers that we're fortunate enough that we can pull that really impact our quality of life and over in combination with our longevity. So we have a high quality of life. And what are those things? Sleep, regenerative, recuperative, restorative sleep. Exercise, meaningful, impactful exercise, not going, balls to the wall 24/7 with exercise. That's wrong. Then restorative therapy. So the things that you do to reduce stress, prayer, meditation, tai chi, yoga, whatever your thing is. Then your annual diagnostics and taking a deep dive into your diagnostics, nutrition, and understanding that all these different nutrient plans and feeding styles and they're tools. They're not meant to be forever. Uh, and then epigenetic testing, hormones, supplements. We have all these amazing levers that we can pull to really impact a patient's overall health and wellness, their quality of life, and ultimately their longevity. So, and melanotan too, and many of the peptides that we have available to us, and hopefully we can keep them around, really do positively impact not only ourselves, because I know many of us use them, but also our patients' lives as well.
All right. So, FYI, let me just mention that I've one of the owners of a local compounding pharmacy, a very large one that does all 50 states. They're my patients, and just for HIPAA compliance, I'm not going to mention their names, but they just they don't do any like injectable peptides, but they said tomorrow, which is Thursday, there should be hopefully good news from the FDA about peptides. So, but I wouldn't hold your breath because I've heard that story many times.
Right.
But you heard it from their lawyers who are working with the FDA. So anyway,
That's always good news. We've had a little bit of a mess here in Ohio as of late because of some rogue, I'll call them health, wellness, longevity clinics being operated by non-medical personnel, ordering peptides from all the pharmacies that we know and using single dose vials as multi-dose, multi-patient vials, which then led the state pharmacy board here to just shut it down. And so everybody that was shipping into Ohio, VPI, Southlake, Brooksville, they pulled all their licenses to ship into Ohio. So last couple months have been a little problematic.
right. Oh well. So let me just think. Well, if anybody has any questions on
Yeah.
Bob's talk, you could speak up, or you can just type it in the interface. Uh, anyway, there was a question about a peptide called link N peptide, and I just kind of looked that up while Rob was talking, but you're not going to know every single peptide out there. I mean, I'm learning about peptides every day. So there's literally 300,000 peptides that the human body produces, and there's over 9 million peptides in the plant world. So even in your lifetime, that you will never know 1% of all the peptides out there.
Medical pep, I think there's over 10,000 now.
Yeah, it's
Yeah.
incredible.
So, yeah, good luck.
Yeah, so don't expect to know everything about peptides, because I mean, the basics, and then if you learn new stuff, then you learn it. So cool. All right. So um, does anybody have any other questions for Rob? All right. Well, have you used the melanotan 2 for more than, let's say, some patients more than 5 years? Just curious.
No, I haven't used it long term. I haven't used it more than, I would say, probably the longest 12 months. My goal is to use it as a tool
Right.
to create positive impact and then move them away, because usually over time with melanotan 2, you're going to see darkening of freckles, especially if they have freckles on their face, and they might not care
Right.
to have that, right? And so uh, the goal is always like get them moving in the right direction, get them in a more healthy driven lifestyle where they can use nutrition, exercise, sleep, restorative practices to maintain their health.
Well, you got to be also careful in using, especially melanotan 2, is that some people really get dark, and if you stop it, they go back normal. But some people have used it and then they don't go back to normal. So
Yeah, right.
there's a point where the body goes, I have too much melanin, so it's stuck. So anyway, FYI, for
Yeah.
those who are interested in
There's
long,
questions to restate the dosing 2.5 to 5. Yeah, that's correct. I'll say micro dose it, because the goal isn't to get them tan. The goal is to get the lipolytic effect and the uh, uh, appetite suppressant effect, so that we can stop the excessive snacking. Because somebody that has the leptin insensitivity gene knockout, they'll tell you when they eat, how when you eat, you go, it's time to stop eating because I feel full. Your brain is telling you you've had enough. Well, in these individuals, their brain doesn't tell them that. Oftentimes they'll have other problems from their excessive snacking and eating, because they don't get the same signal that they're full. And so the way they sense they're full, and I've had patients tell me this, is like they don't know they're full till they feel it in the back of their throat. They feel bloated because they never have the sensation of feeling full. They feel like they could eat until it can't comes out of their mouth. They just don't feel full. And so the goal of using the medication is to give them that sensation. And oftentimes they say, it's like, this is amazing because I'll eat and I'm eating way less than I would because I feel full after, 6 ounces of filet and 6 ounces of rice. I'm full. Whereas before I could eat the whole pan of rice and eat like 3 or 4 steaks. And I'm not going to stop eating until I feel it in the back of my throat. So they don't have problems with like reflux and gastroesophageal issues and bloating. And, so it's pretty interesting when they get the appetite suppression from it. Could you cycle this peptide? Yeah, I would say cycling would probably be a good idea. I always try to use it short term so I can get things corrected. And then I have them dose it at the beginning of the day. So the appetite suppression is daytime, unless they're complaining they have the nighttime hunger and they can't sleep because of it. But generally, I dose it first thing in the morning.
one interesting fact is that in endocrinology, when I was in my fellowship, we learned a lot about leptin, and there were kids who basically were morbidly obese by 5. And, children know when to stop eating. They just, start eating and they'll just stop and they, you know, go and play. But these kids could not stop. I mean, they're like, their knees are, they're going to have to get knee replacement because of their weight at a very young age. And it turns out that the GLP-1s was a lifesaver for these children that were leptin deficient or severely leptin resistant. So now we have the melanotan, uh, 2 peptides there. So it's interesting. The receptor site, the 3 and 4, is really interesting.
It is, and it's crazy how well it works when you're dealing with somebody with leptin insensitivity. And they're amazed. It's like it happens very quickly.
So on the Intellex SNP test, did they look at the leptin or do they?
Yeah, it's in the obesity section. So they have several sections. Intellex is a fairly comprehensive DNA test, and anesthesia, celiac, memory, CRP, diabetes, endocannabinoid, toxins, heavy metals, thyroid, obesity, macular degeneration, cardiac detox, Hashimoto's. They have all opioids. It's a very statins, very comprehensive. And so in the obesity section, they screen for leptin insensitivity, the LEPR gene.
All right.
Yeah.
So anyway, thank you again. Great talk. FYI, we do have several other amazing webinars coming up. So anyway, March is right on the corner. Ask your peptide questions. Then April, we have Michael Antonelli from Healthgevity. He's going to talk about 2 new peptide products you can get it oral. And then Dr. Zan Simonson will be talking about bioregulators, explain small peptides, big impact. And then June, we will have Dr. Greg Jones on the AMPK activators, the AKT304. He's really excited about that. So anyway, some cool stuff. So stay in tune, and hopefully tomorrow will be a great day, and we can celebrate from the FDA. All right. So thank you, everyone, and have a great evening. Thanks, Rob.
Thank you.
Bye now.